Hello, thank you for joining us for our latest installment on our conversations about healthy communities here at CHI St. Joseph Children's Health. I'm Phil Goropoulos, the president of your local market here in Lancaster, and I'm excited to bring these conversations to you every few weeks as we kind of explore what are the basic pillars that create and can sustain a healthy community here in our Lancaster area. The sisters who founded our hospital back in the 1880s didn't come here to found a hospital. They came here to help the Lancaster community achieve this desired goal of a healthy community. It's that legacy that we continue to try to fulfill at CHI St. Joseph Children's Health today, and part of the reason why we've engaged leaders like our guest today and others in this extensive conversation about what their feelings are, what their experience brings, and what they view as paths forward for our community as we create that healthier community for all of us. Today's guest is Bryan Cutler, representative from the Quarryville area, who is now, as of June, the Speaker of the Pennsylvania House of Representatives. So I'm very excited to have Representative Cutler join us this evening for our latest conversation. So welcome, Bryan.
Thank you very much.
I should have asked if I should call you Bryan or Representative.
Yes, no, you have it right.
So anyway, appreciate you joining us. It's an exciting time for us to have these conversations as we kind of try to envision a world post-COVID, post-pandemic and shutdowns and see what the future holds for all of our community. One of the things that we've done traditionally, usually with speakers who are coming to us with extensive either international experience, like President Margie Ensign from Dickinson College, who had worked in Nigeria for a number of years, but also chef and humanitarian Jose Andres, when he was with us as an immigrant from Spain, was to ask them kind of what they viewed as the United States, what they wished people recognized, as opposed to kind of the stereotypes of what America is to many people. I find that there's a similar thing. Like both you and I grew up, for the most part, in Lancaster County, and have also traveled outside in various parts of the state and the country. And I know that when I went to Dickinson College, I was asked by multiple people on my freshman floor, are you Amish because you're from Lancaster, and everybody in Lancaster is Amish. So I thought we'd take a little twist on this question and pose to you as a lifelong Lancastrian, what you would like people from the community to know about Lancaster that is often overlooked in that kind of stereotype of a tourist location for the Amish community.
Well, for starters, I had the same question that you got on your freshman year. I've had several people ask me that when I say where I'm from. And, so I think in terms of what people may not realize, really for me, and it's something that I was blessed with when I was younger with my own family situation, it's the ability of the community to come together and support one another. In regards to that, they don't care what religion you are. They don't care, where you live or where you're from. It's, are you our neighbor? And they show up. Like when somebody dies or somebody gets sick, they show up, they bring food, they help you do yard work. In our case, we heated our home with firewood. So they cut years worth of firewood for us and stack it. It was the Lions Club. It was the Farm Women Association, which is a Bible study of farmers' wives. And it was our friends and our neighbors. And they have an incredibly giving heart. And that's something that I think that particularly in this day and age, we need more of.
Yeah, I think that's definitely true. I think one thing that we were having one of our conversations, I think with Sister Mary Haddad from the Catholic Health Association, we were talking about the number of refugees who are resettled here and how that's a point of pride in the community, regardless of your religion or your political affiliation. Whenever you talk to people about what we've been able to accomplish and the way we've welcomed and opened our arms to these individuals who have been displaced, it's such a source of pride for the local community.
Yep. Yeah, absolutely. Because I just think it's something that makes us strong. It's something that I think everyone that has lived here recognizes. And then I also think that it's something that continues to be very appealing to those from the outside as they move here. And I just think it's a neat component of our community.
So, I mean, the Quarryville community is, many people may not realize where it is. I'm not sure, like I played Swanko in high school, but I'm not sure I could have found it on a map at the time that we were playing. But it played such a huge role in helping to shape who you've become and getting you to the opportunities that you've had and becoming a successful adult in our local community. A few years ago, we hosted a staff conference on poverty and the impacts of poverty, and one of the guest speakers we had come was David Grusky, who is the head of Stanford University Poverty and Equality. And he framed it in a different way for me, because it's always, whenever you talk about poverty, it's usually like a dollars and cents issue, because that's how we define it. It's so much earnings, versus the number of
Right.
people in the household. And he really said, like, systemic poverty really ties back to the number of opportunities we're able to have as children and as adults. And it's partly about how do we secure those opportunities. And he went through a whole scenario of really outlining the differences in opportunity, basically even from side of the street to side of the street. So if you live on this side of the street in Palo Alto, where Stanford is located, you had this school district, this many opportunities, this type of criteria, this is what your median income was. And then you cross the street, it's the exact same street, just the other side. And now all of a sudden you're in a lesser quality school district, which lowered your opportunities. Your parents will probably make a significant amount of less money, which means they can get you less, sports teams and other opportunities that might have a cost associated with it. And I really walked away from that feeling like part of the solution is kind of changing how we discuss poverty to we're talking about creating opportunity as opposed to addressing this financial need necessarily, which I realize is a longer term framing of it. Drawing upon your experiences and kind of the roles that communities can play in creating opportunities. So how do we assure access to every child to opportunities so that they can have that kind of building and path towards a brighter future?
Yeah, to build a little bit off of what you kind of covered in the question there, right now, as of today, the number one indicator of your potential for upward economic mobility, in other words, can you live a better life than your parents had? Or can you, if that's how we define success, is that achievable? The number one determiner in that question is actually your zip code, to your point. It depends entirely on where you live, and that's unfortunate. I think in a lot of ways, and it's one of the reasons why I support school choice, I think that every kid should have every opportunity available that is within the system. And unfortunately, sometimes the system actively works against them, whether it's by limiting those choices or if it's just the mechanics of, as you pointed out, of you may not have the money to get to transportation or to excel in certain areas or participate in sports or science camps or whatever they may be. Mm-hmm. And so that's always been, first and foremost in terms of my own public outlook in terms of really growing the opportunities for individuals. I'm a product of public school. My kids actually go to the very same public school that I went to. And my oldest daughter has on several occasions had the same teachers. So that does make for some awkward parent-teacher conferences. I remember walking in to my second grade teacher, who also was her first and second grade teacher. And for our first conference, and she goes, I said, "Hi, Mrs. Bachman." She's like, "Well, you can call me Karen now." I'm like, "Yeah, I won't be doing that." But, we are blessed, at least here in our school district in Solanco that you mentioned earlier, that we've got a lot of very committed professionals that have been here for decades. So that does provide some stability. They've also got a very robust approach to educating kids. And, I was personally impressed by their flexibility and their ingenuity with the COVID crisis. Now, it's been bumpy. I'll tell you as a parent, it's a little difficult. When we were prior to recording here, you saw that my son's name was up on the Zoom, and that's because he was using it for school. So there is a competition, if you will, for resources even in the house in terms of computers and things like that. But it is manageable, but it is something that some kids, many kids, as a matter of fact, in the Commonwealth don't have access to broadband. We're fortunate. Ironically, we just got cable internet a couple years ago here. So even for me, where I live, that's something new. And I know that there's wide swaths of the state that have yet to get that access. And if nothing else during this pandemic and the shift to either full online or some kind of hybrid, like my kids are currently undertaking, where they're physically present for 2 days a week, but virtual the other 3, broadband is absolutely necessary in terms of gaining that access. So we wrestle with a lot of those. And again, that's dictated by your zip code. And, if the further out you live from the urban or the suburban areas, the more difficult it is to run the lines and get the access that everyone needs. And that presents some unique challenges. But in some cases, it's extremely costly. So you've got to try to figure out how do you meet the greatest needs for the greatest number of students in the area that is most cost efficient to benefit everyone. And so from a policy standpoint, that's something that we do. I personally believe that education is the great equalizer. I was very fortunate. I had some wonderful teachers early on in my own educational journey, because I was not the best student very early on. I've had the ability to go back and visit many of my teachers, and it's interesting given my current role. A lot of them always say, "Oh, we always knew you'd be successful." And I said, "Well, how about I read to you what you wrote when I was in your class?" And my mom, God bless her, had saved all my report cards. So I've been able to do that. And it drove home the importance of having them as professionals, interacting with me and molding me in those formative years. My very first interview after becoming whip, and then again as leader, and then also as speaker, was I thanked many of my teachers. Despite my job, I don't like public speaking, but Miss Pasco, who was my 12th grade speech and it was public speaking and writing teacher, was the one who got me to overcome my fears of public speaking. And, I was very blessed to have Mrs. DeBurdine in 6th grade, who really drove us to excel. It was a unique approach. I'll never forget, she made us sign a contract in her class. And you could decide if you were going to get an A, a B, or a C. And I thought it was kind of a weird approach at first, but she said, look, she's going to be very clear. She said, if you pick C, you had to do like 20 of the things on the list. If you wanted a B, you had to do like 25. And if you wanted an A, you had to do 30. She said, if you pick a C and that's all the higher you're willing to aim, you could get 100 on every one of those projects, the 25 that you do, and you're still only getting a C because that's what you picked. She said, now conversely, if you pick the A, but you turn in subpar work, she goes, you could get a C. She goes, but you should always stretch your goals and strive to achieve them. And that's a lesson that I learned thanks to her. And I get to see her a couple times a year. She lives just north of the district. And every time I run into her, I still thank her because education is so very important. It's important to our opportunities. It's important to future success. And we really need to be mindful of that as we shape our policies, because that's what really will drive our future.
I think that's a great point. And when I was talking to Mike Leichletter from Penn Manor, the very first of the series, we were talking about the ability of teachers to touch lives, and how could he, as a superintendent, encourage teachers to take the risk to create, and again, appropriate relationships, but make sure that they're becoming that source of inspiration. Like, and I could talk about my 5th grade teacher. We became friends on Facebook, and when he liked something or comments something on my Facebook page, it still means so much more to me because that was someone I really respected. When we moved back to Lancaster, my English teacher from 10th grade, it turns out, lives in the neighborhood, and she's like, "Oh, you probably don't remember me." I was like, "No, I know exactly who you are." And not in a bad way, but because she had that positive, and actually had because she made me work hard, but I knew that she cared about me and she was doing it because she wanted me to be the best that I could be. She always, I knew exactly, as soon as I saw her across the street, I knew exactly who she was. And those are the types of relationships that are so essential to our children being successful in the future. And I wonder, there's always that cliche talk, I guess, that we've gone from being front porch towns to backyards. We used to sit on the front porch and we all knew our neighbors. Now we sit in our backyard with our fences and we don't even know who lives right next to us. So I wonder how we can, as a community, start to encourage, once we get past, the needing to mask and socially distant, how to start encouraging that connection within communities again, where we see ourselves as part of the whole, where we're going to look after the person across the street and get to know the person that lives next door to us, because there is that thing. I can remember being left home, and before some of the regulations have changed since my parents did that, but being 10, 12 years old and my parents feeling comfortable leaving me home alone because the neighbor was home. And if I needed something, I would be able to go across the yard to them, and they knew I would be safe to do that. When so much has changed, when, it's not like you want to go back. I'm not trying to say we should live in a world of nostalgia. But in some ways, we've handicapped our kids today with the kind of structures we've had to put in place.
Yeah, that's actually one of the things my wife and I were just talking about in regards to the COVID crisis and the early days of the shutdown. For the end of last school year, I personally really felt like my kids got a small taste of what my life was like when I was a kid. Because I don't ever remember being as busy as they are now with sports. You know, when I played baseball, it was, I think we had 7 or 9 games and you were done, unless you made the playoffs. Now it's year round. My daughters play volleyball, and it's the same thing. They could play year round if they chose to. And when COVID came, it really, it really limited what you could do outside. So what happened inside our family was we found that we weren't running every evening. We actually would sit down and have a dinner more regularly as a family. And we spent a lot of time working outside as a family. And we still heat our house with firewood. I live in the same house I grew up in. So we cut and split and stacked 2 years worth of firewood during that time period, in the evenings and on the weekends. And now they complained a little bit while we were doing it, but it was an important life lesson to show them, the wood just doesn't happen. You've got to put the work in now so that you're warm this winter and then again next winter, because it needs time to dry. You need time to plan. We started clearing some land for an orchard. And all of that really makes you look to the future much more so than I think our society today typically does. So I actually, I enjoyed some of the lessons that came from that. I felt like they really got a taste of that kind of lifestyle that my wife and I, and it sounds like you as well, really grew up with, in terms of just being able to spend time with each other and get to know each other well, because, when you're working side by side with somebody for 6 or 8 hours, on a Saturday, you get to know them pretty good. So it was one of the benefits, I think, of a very unfortunate time.
Yeah, I agree. It has really let people, at least I hope, take the time to really reevaluate some priorities, and it doesn't have to be this constant rush. And we lose so much in that. I think one of the things I talked about with Margie Anson was around the idea of, understanding different types of cultural families, and how, in the United States, it was wasn't unheard of. Like my parents still live here. You pack up and you move to Colorado because that's where your job is.
Right.
And, I'm very blessed, that I live right across the street from my mom, and we made a conscious decision to build houses right across the street. So my kids would constantly be in both homes. And that has turned into such a huge blessing. But because of this, she is able to make sure I can do the work I do here while the kids are safe and she's
Right.
helping schooling. And, but so many people, forgot what an extended family was, or have never had a relationship with their grandparents. And I think we become less as a culture when we don't, you don't have to hold hard to your roots, that you don't change anything, but that you don't recognize your roots and help your whole family appreciate it.
Right. I think it's a good point.
So one of the things I wanted to tie in off of the other family, obviously, like to us, one of the opportunities as a health system that we're obviously very concerned about is access to healthcare. I know you have a healthcare background, which I think is one of the fascinating parts of your career path, as well. So we spent some time in the conversations talking about, basic access to healthcare, and I think some of that gets into, very heated conversations potentially about the Affordable Care Act and how you go about providing access. One of the things that I think many people aren't realizing is happening in healthcare is the plight of more rural communities. So in Lancaster, we're blessed. We kind of seem like we're like the battleground of like 4 huge health systems trying to make sure that our needs are met at the current time. But if you go out into Clearfield County or Huntington County, where there might be one small hospital that's independent and is really struggling financially, I think you've seen this across the country, where those hospitals are closing because they can't survive in the current model. And then families and children are left with no hospital or healthcare access for hundreds of miles potentially. So, I wonder if we could talk a little bit about things the state might be able to do to just assure basic access. And again, I'm not talking about how is it paid for necessarily, but how do we make sure there's a doctor in town, if a kid needs it. And that's kind of a scary thought when you live in a more rural area and it's not easy for you to drive, 150, 200 miles to get care.
Yeah, I'll share an experience that I had in a more rural setting. It was not here. Several years ago when we were out at Yellowstone, I ended up getting altitude sickness from a hike that we had been on. And I went to the urgent care center, which was conveniently about half a mile from the campground where we were staying. And when I went in there, they checked me out very quickly and said, you need to go to the hospital. You most likely have altitude sickness and we can't treat that here. So I then had to pile in the car and drive about 4.5 hours to get to Bozeman in order to go there. So it's not just Montana that has those kinds of large holes. I sit on the Pennsylvania Trauma Foundation, which is for certifying and reviewing and setting the standards for all of our state trauma centers. And if you look in the north central part of our Commonwealth, so up into the Potter County, like up in that region that you referenced as well, Clearfield, Potter County, like that whole circle up in there, it's more than an hour to get to a trauma center. So from a policy perspective, in terms of ensuring access, we have tried to develop level 3 and level 4 trauma centers, which would essentially be feeders or partners to the higher level trauma centers, so you can be stabilized and then transported. So that's a practical example of where we as a legislature are engaged. We recently just rewrote that law at the beginning of this session. Governor Wolf signed that, I think it was last June, if I remember correctly. In terms of general access, specifically Medicaid and the state exchange, we actually also worked on a bill, myself and Leader Dermody, that let the state take that over from the federal government. So what that does is actually we got a waiver from the federal government that would allow us to take the savings that we were going to get and then drive that back into a reinsurance program, which means that anybody who buys on the exchange will actually have lower cost insurance than had they not, or had we not taken that over from the federal government. We can run it for a fraction of the cost of the federal government. And our folks, so far have done a great job of kind of building that system up. And that's going to be rolling out this fall for next year's premiums. So we should see some cost stabilization and hopefully reductions there as well. So those are two actual examples. The other things that you can get into is obviously programs to go into the underserved areas. Most times when people hear the word underserved, they think of the really poor urban centers. But as you pointed out, it's also the really remote and usually equally poor rural places that have those same kinds of struggles, but for different reasons.
I think some of those areas are the hardest to recruit professionals to work.
Correct. So there's some incentives in place with loan forgiveness, both federally and at the state, where we could try to get folks there. Another part of it, obviously, or of that discussion at least, is what do you do to extend that care? Telemedicine is one of those. Can you provide services remotely? I think the pandemic and the COVID crisis has certainly pushed us to that much quicker than we probably would have otherwise adopted to that. But it's currently happening. We need to catch the insurance regs and the payments up to that. But it's manageable, I think, from that perspective. I think that some of the other things that we can do is talk about how do you extend those professionals. So there have been debates about, do you extend further privileges or scope of practice for some of the mid-level clinicians, whether it be nurse practitioners or those kinds of points. There's currently a bill working through the process that would really target those more rural and access problem areas. Chairman Hickernell has been working on that. And, those are very real issues, both in terms of insurance coverage, which is the payment component, but also just the actual services. One of the biggest shortcomings, I think, of the Affordable Care Act, put the politics aside for a minute, because, regardless of whether you think it's a good idea or a bad idea or what that approach looks like, the truth of the matter is just because you had coverage in Medicaid didn't mean that you could find a provider. Whether it's dental care or, some subspecialty where you might have to wait weeks or months in order to get seen. So we really need to change that discussion as well to ensure that those underserved areas have access to those different levels of services that might not be as prevalent in some of the areas, whether it's urban or rural, based off of, simply just not having the personnel there.
I think that's part of the big challenge. One of the things that we were here working in Lancaster around a mental health collaborative. There was a huge discussion about we have to raise awareness about that it's okay to have depression and there's help. And I kept saying, okay, well, if we make a whole lot of people aware that they have depression, do we really have the help? Like, that's the part of the question that's the harder part to solve. Raising the awareness is important, but we've got to make sure we can back it up with the services and supports for those people that need them once we identify that they have it.
Absolutely correct. This is a somewhat dated statistic, but I think it was in the mental health arena. The average age of the psychiatrist, I think, is over 70.
Yeah, doesn't surprise me. Working with psychiatrists and trying to recruit some more to the Lancaster area, I can tell you it's not an easy feat.
No, and not as many people, not nobody, not as many people are picking those subspecialties as other ones, orthopedic surgery or neurosurgery or, family medicine even. So it's a challenge because you really need a pipeline of professionals and you need to make sure they come here.
And it speaks to also like the disparity in how we reimburse services. So the fee-for-service system within behavioral health, as a behavioral health provider, we're very keenly aware of it. It's on a separate fee schedule and growth trajectory in terms of trying to cover additional costs than traditional medicine. So there's not adequate reimbursement. And the fact that we talk about healthcare, as someone who used to be a provider, from a reimbursement perspective is kind of somewhat, funny too, that you put out the cost first and then you hope to get some money back from the insurer for the services you already provided.
And the other problem, I think, there's the disconnect between the mental health and the physical medicine component. Those are bifurcated here in the Commonwealth in terms of the Medicaid population. And so what happens is a lot of times you'll get the mental health folks saying, well, that's actually a physical medicine problem. And then the physical medicine people say, well, that's actually a mental health problem. And then everybody stands and points at each other when the patient's kind of trapped and can't get the treatment or the medicines that they need. And, particularly in the mental health world, that's an area where I think we could make some substantial improvements in terms of providing care. Because of those disagreements that sometimes occur between the physical and the mental sides, but also just the coordination of care. There are some privacy issues there as well, both state and federal, that cause the treatment of other underlying conditions to be a little more complicated perhaps than they need to be. Talking to some clinicians, that's a huge compounding problem when you don't know about perhaps other medicines, psychotropic meds or whatever else the patient may be on. And if the patient doesn't share it, you may not always get complete closure in terms of the records. And that causes some issues as well.
And then you're relying upon, in essence, the catch-all would be the pharmacist. But then with so many pharmacies now in the community, it's not like everybody goes to the same community pharmacist. And those records aren't shared either. So you still could have counterindicated medications or a potential accidental death as a result of someone not fully being aware of what's going on. Yeah, I completely agree with you. On the other side of health, in terms of on the public health side, again, not looking at COVID, but I think what COVID kind of pointed out is we kind of got caught a little bit flat-footed in terms of response and communication. I know that's been a hot topic in the legislature and in the newspapers and in the local communities. And I don't want to debate the pluses and minuses of the approach that we took, but more, I'm curious what you've observed and learned thus far in terms of how we can kind of reform our public health structures a little bit in Pennsylvania, knowing, like, for example, the county health department code is really from like the 1950s and hasn't really been updated to help facilitate the creation of like county health departments that might better equipped like Lancaster to respond to another outbreak.
Well, and actually the Disease Prevention and Control Act, which is the other law that we're really dealing with a lot here, has also not been updated significantly since the 50s. It basically dealt with tuberculosis and STDs. And so like when you look at that, it's really not positioned to help or work in a scenario like we've experienced over the last, I'll say, 9 months. And that's part of the problem. Obviously, there was also a disconnect early on between what the county health departments could share in terms of information and constituent services versus what the state was. Generally, I generally think that a decentralization in terms of delivery is always better because the local folks will likely understand and anticipate and correctly respond much quicker than someone in Harrisburg. That's kind of just a generic point. I think local control is generally always better. Now, with that said, I absolutely think that there needs to be both state and federal coordination of that local control. And I think that everybody would agree that communication could be a little bit better, whether it be specific to the healthcare, the actual data and the information in terms of, what's the average death, what's the comorbidities. That data is very important because then it helps us, not just as policymakers or you as a healthcare provider, but also me as a person. If I know that asthma and hypertension and diabetes or, any other number of healthcare issues compounds the likelihood that I could have complications from COVID, I would make a different decision. Okay, do I go to the grocery store or do I get somebody to go, for me? And if I'm older, the average age of death, unfortunately, here in Lancaster County, I think 77. And the vast majority of the patients that we've had have really been from long-term care facilities and nursing homes, as people may colloquially call them. The reason I share that is because I think even after you and I get more back to normal in terms of daily engagement, I do think that nursing homes will be forever changed in terms of visitation policies and some of the protocols that they'll need to continue to do in terms of monitoring just because until we get a vaccine, because I think that really is just a way that component, if you will, or lifestyle going forward will be very different. And all of that in order to make good decisions. And I'll borrow a term from, back when I was in middle school and high school and learning computer programming, you put garbage in, you get garbage out. You have to code well. And in this case, it's good data in drives good decisions. So you need to know what are the comorbidities, who are the at-risk populations, where are the hotspots, so that you can focus contact tracing and PPE and that really focused response. I understand it's a once in a century probably, and hopefully once in a lifetime or a multi-generational time before this comes up again. But we have to learn from it in terms of what the response was, because I think in some cases, and this also drives into healthcare, I think one of the untold stories, unfortunately, of the original response in the lockdown will be that students have really suffered from an educational and from a socialization standpoint. Particularly those individuals, which we alluded to earlier, that have mental health problems and already deal with some level of ostracization or feeling separated from their colleagues and their friends and their peers. Some people, unfortunately, the only food that they get is at school. And, we have programs here locally where they give out, the power packs with the backpacks with the food in them. And, we responded and we eventually got that back in place, but there was a period of time where that wasn't being done. And so I think that the educational shortcomings and the social shortcomings and the mental health problems, as well as the food issues, and sadly, some people, whether it be students or spouses, are trapped with their abusers. While I was able to spend more quality time with my family, that's not the case for everybody. And so I think all of that's going to manifest itself into the healthcare system. And then longer term, by not having the non-emergent or the elective surgeries, as they were called, or screenings, you could have a whole host of different cancers or other healthcare problems that could have otherwise been avoided that are now, at the forefront, 1, 3, 5, 10, or even 30 years from now.
I think that was one of the things that with healthcare, people didn't understand the impacts to providers.
Right.
We use the term elective surgery, and I think so many people think that means like, oh, well, we didn't do as many like plastic surgeries, so someone went without their nose job for a couple months. What's the big deal? But we're not really talking about that. We're talking about a heart catheterization where it was not blocked as far as it could have been, and we're hoping that it doesn't block up the rest of the way before we can get to it. Like that's a pretty major surgery. So I always laugh when it was always like, oh, well, hospitals have had to put off elective surgeries. And everyone's like, well, what's the big deal? It's like, well, it's a really big deal.
Yeah, it's a huge deal. That's actually why I led with the term non-emergent. You have a heart attack, you're likely to get that catheterization or the open heart surgery. But many cases people put off getting spinal fusions or spinal surgery or hips and knees replaced or any number of non-emergent but quality of life important decisions, and that will have a trickle down effect for years to come.
And it pointed out the problem with, in my opinion, some levels of the payer mix, that hospitals are driven, to have to make sure these things are happening just to stay financially solvent to be able to deal with a situation like COVID.
Right.
Which is kind of a catch-22 for them, because now they're trying to be responsible and create safety. At the same time, can they survive, and how long can they survive before they financially jeopardize their entire operation to do a community service, really, with the COVID response.
And then back to the earlier point that we raised, some areas only have one hospital. So if that hospital closes, you're out of luck. And that's something that we have to really keep in mind as we do ramp things back up, is understand what that patient mix is, what's the impact on the payers, what's the impact on the population, and what does it mean longer term for access.
So this summer, obviously we were dealing with COVID. Then you had the whole series of events that raised consciousness to racial injustice. So you had the killing of George Floyd, the shooting of Breonna Taylor. They all kind of awakened some people to the idea that there is some systemic racism throughout our society, and we should probably do something to try to address it. From our perspective, as a location of a Catholic health system, racism is very clearly a sin for us, and we've had the Pope out speaking very clearly about this over the past couple months, really tying it not just to the current situation, but tying it to Catholic social teachings from the very beginning of the church and before that. Our CEO is a gentleman named Lloyd Dean. He also spoke very clearly about our system's commitment to it, and actually through a webinar we just hosted for staff, shared some of his own personal experiences as an African-American man that impacted his ability to access healthcare when he was young, and the causes and effects that had with his own family as a family of people of color. So I'm wondering, these aren't new challenges. They've kind of been underlying challenges. I think sometimes we recognize, and sometimes we like to pretend aren't necessarily underneath the surface a little bit, but they got rubbed really raw, in essence, this summer with all of the instances. So you saw the protests and people calling for change. So what, again, from that state government perspective, what types of levers are available to push to try to create some change and work towards a healing and reconciliation of the community?
Well, like you, I mean, my own personal beliefs are rooted in my faith. And, the golden rule is, treat everyone like you want to be treated. As a matter of fact, as I was growing up, and I've shared this repeatedly during public, speeches, whether it was on swearing in day when I became majority leader, or again, as speaker, I had 3 rules growing up. That was the first one. You treat everyone with respect and the way that you want to be treated. The second one, was that you never ask anybody to do something that you yourself aren't willing to do. And the third is that you always leave things better than you found it. Mm-hmm. And I know that's probably an oversimplification, but I think those 3 points, and our local paper had ran an op-ed on them. And I told them, I said, it's really unfortunate or sad that that the public thinks that these 3 things are so novel. Because I think that those 3 things would go a long way in dealing with a lot of the issues that we've been dealing with over the last, actually it's years, but more recently the last several months. The good news is Harrisburg is not Washington, D.C. We've passed, we had one of the busiest legislative sessions. And I share that because I know it doesn't get a lot of press, but my friends and my colleagues that I work with in the House and in the Senate and the governor, we passed, I think it was 580 some bills so far. That's more bills than most sessions ever cover. More than 220 or 230 of those became law. And in those bills, there were things that address many of the issues that you bring up. Some was on police training. There were 2 bills. They're currently working on a couple others, probation and parole reform, licensure reform, in terms of giving folks a second chance. I think that's a very important part of not just forgiveness, but also ensuring that individuals are able to provide for them and their families. We as a society can't say, well, once you serve your prison time, whatever that is, or your probation, or whatever the court says is the appropriate time, we can't then say, oh, and by the way, you can no longer work at all these different places, and then act surprised when they go back to a life of crime. So we lifted many of those restrictions and tried to improve those situations, because I think that it's important to give those individuals that opportunity. Once they've paid their debt to society, it is time to move on, and it is time to ensure that they have opportunities. We also dealt with some of the police training and some of the other issues and the other bills. The other thing, which goes back to the very first question, is really educational opportunities. As we continue to improve educational opportunities, I really think that's not just the great equalizer in the workforce, but it will also continue to be the equalizer in society. If you're presented with a good opportunity in terms of quality education and able to work hard, you will naturally succeed as those opportunities come up. And that's not to say that it's always going to be easy. And I understand that. I talked to my family and a lot of my friends growing up. My dad was a welder. My mom worked part-time for the local family doctor as a nurse. And, we realized as we got older that truthfully, all of us were lower middle class or working class poor. And yet we didn't realize that because we didn't see the difference between everybody in our classes. Mm-hmm. And, we were blessed though to come from a strong home, in terms of having a mother and a father who loved us and wanted us to have quality education and opportunity. So that's a huge plus, I think, in terms of being successful. And, they really drove us to treat everyone with respect and to work in a way that would really kind of create your opportunities as you go forward. Now, unfortunately, my father died when I was a senior in high school. My mom was terminally ill, but that's where the community came in. And to your point earlier, I mean, if my friends and neighbors, that lived next to us didn't even know who we were, of course they're not going to help us. But in truth, here, it was the exact inverse. We don't really have a transient neighborhood per se. Individuals that have been here typically live on the same family farms and the same family homesteads that their parents and grandparents lived on. So everybody really does know everybody. And I think that does help lend to a network of support in those particularly troubling times. And so back to the criminal justice reform and some of the other bills, we've got some of those done. We're going to keep working on the ones that we have. But I also think that education and workforce opportunities play a huge part in that, because that's what gives you the ability to then make different choices or to perhaps move to put your kids in a better school or, whatever you as a family member, a mom or a dad or an aunt or an uncle, or as we've seen, unfortunately, with the opioid crisis, grandparents, then can make those decisions in a way that is beneficial to not just their own family, but really, quite frankly, all of society.
Mm-hmm. I think one of the things that's been interesting in all of these conversations is visiting and revisiting that concept of the common good, that idea that there's this commonality that we're working towards that would advance everybody together if we could find it again. I think part of what you see in all, and again, it's what you see in the news, and it's also what you're somewhat experiencing with now all the signs all over every yard right now. But everything's kind of become hyper politicized, and it's not the first time that that's been the case in this country. There's been many periods throughout our history where it's become kind of very political, and everything kind of is tied back to politics. But when you look back at some of those times, it seemed to be that you could find some sort of common ground. So there was intense disagreement about how we might get somewhere, but it seemed like everybody was trying to get to the same place. And the example that I give is, around, in the 80s when you had Ronald Reagan in the White House, you had Tip O'Neill at the House, two diametrically opposed people from an ideological perspective, yet they were friends. And they could come together and they could see we're trying to create a better America. And we're going to compromise on this and this, and we're going to get there together through this path. And you don't hear a lot of that type of conversation these days, at least from the Washington perspective. It seems like there's more getting done in the Harrisburg side, which is a great thing to hear. But I think that the kind of the $1 million question is, how do we return to the fact that we have kind of a common vision of a healthier, more prosperous country for everybody? And then we can talk about, in a civilized manner, this idea of how the different strategies might be to get us to this goal. We kind of lost that common dream.
Yeah, part of it, it goes back to my first role, which is treating everyone with respect. Every summer I personally will pick up a book or that covers a topic that I may not personally agree with, because I want to understand what the other side is and whatever the particular issue is. Or it could be on somebody that I may not politically align with, or somebody that I just don't know enough about. So for me, part of that's a personal pursuit in terms of understanding where folks are coming from. Truthfully, and I said it on purpose, Harrisburg, thankfully, is not Washington, D.C. And I do think that a lot of that is hyper-partisan right now, as it tends to be as you head to election time. That's not to say that we're without our own partisanship, but the truth is, our colleagues, both Republican and Democrat, I think work very well together. We don't always agree, but the truth is that's why we vote. And most of what we've passed has been bipartisan in terms of having support. So that's Republicans and Democrats. Most of even the vast majority of what passes also is unanimous. And I recognize that that's not real appealing in terms of headlines. Everyone agrees this is the right thing to do. Doesn't really read well. Instead of House, Republicans or Democrats do A or B. I get that headlines lead, but the truth is, I think we really need to focus more on what you pointed out, those areas of commonality. What we have in common, and I said this during my swearing in as speaker, what we have in common is far, far greater than the couple political differences that we might have. And, it was, for anybody who saw my swearing in ceremony, I had a Democrat second my nomination, and then a former Democrat member who is now a judge came back to swear me in. And he and I used to sit next to each other on the floor and are actually very good friends. And the truth is that happens in Harrisburg probably more than you read about in the newspapers. Again, I think folks find it novel that could happen, but the truth is it happens a lot. It's just not always covered. So I think the first step is just understanding that someone else may have a different view. That doesn't make them evil or wrong. But we need to understand where they're coming from and empathize a little bit to understand what their own life experiences are that may have, worked towards giving them that viewpoint or how they responded. And I just think that's a very important part of having that conversation. I'm fortunate in that I work in a work environment that really facilitates those discussions. And then we get to show that action through votes or debate or, whatever route we choose. But a lot of times we find success, and I think that's what's important. And I wish it got more attention. I mention it during every interview and every newspaper interview that I have, or TV and radio, because I am proud of the work of my colleagues. We don't always agree, but what we do have is that commonality and the ability to work in those areas. And we just need to keep working and making sure that we keep working towards those common goals. Because look, I think everybody wants Pennsylvania to be successful. I think everybody wants us all to have opportunities, whether it's as students and as young folks, or as individuals who are pursuing careers, whether it be trade school or college or the workforce. We want to have a greater and a richer and more successful environment for everybody to succeed. And that I think everyone agrees on. To your point, sometimes we disagree on how we get there. Is it a policy of funding more programs, or is it a policy of providing for school choice, or there's any number of issues that we could debate on, but the goals I think are all shared.
Well, thank you so much for taking time today.
You're very welcome. I appreciate it.
And we wish you the best. And as we head into the fall, good luck with the election. And we'll see you soon, I hope.
I'm one of the fortunate ones. I'm unopposed in the fall. So
your election was in the spring. So
yeah, so I'm looking forward to getting through the election, because I do think that once some of the political air is out of the room, I think it does get easier to solve some problems. If you look back at the beginning of the first year of this session, we were amazingly productive in terms of getting bills passed with large majorities, most times unanimous. And we dealt with veterans and emergency preparedness issues and ambulances, and we dealt with education and workforce development and things like that. We really, we were able to focus on those. I know everybody every 4 years really focuses on the presidential election. That is the one that everyone focuses on. The truth is, it's your local elections and your state elections that really probably impact your life more on a daily basis than the national ones that come every 2 or 4 years.
Yeah, I would agree. Well, thank you again. Have a wonderful day.
Very well.